Dowd is introducing House Concurrent Resolution Number 1, a House Concurrent Resolution relating to Minnesota's peacetime emergency. New moves that the rules be so far suspended that House Concurrent Resolution Number 1 be now considered and placed upon its adoption.
The member from Chisago, Representative New.
Thank you, Madam Speaker and members. So today is officially the 8th time we are meeting for exactly one purpose. Today, fortunately, we combine that with another purpose, helping to put a Band-Aid on the artery that is bleeding for our businesses. But we're meeting for the 8th time today to discuss the governor's emergency powers. We are officially in the longest peacetime emergency in our state's history. And Governor Walz continues to refuse to work with the legislature. Frankly, that is evidenced by the bills that were just brought up. I was working on those bills, and like I said, the last bill that was brought up, no one's contacted me since Wednesday. Clearly, there was not a whole lot of interest in actually working with the legislature to get something done on this stuff. So the governor shut down businesses on November 18th, and he had no plan. He had done nothing to consult with the legislature, nothing to consult with the businesses that he was shutting down. Nothing. There was no plan. He just unilaterally made his own decisions without involving anyone to make sure that we were doing the right thing for Minnesotans. And then again, 3 weeks ago today, on November 23rd, the governor stood at a podium and he told all Minnesota businesses that he was ready. He was ready to call the legislature back the very next day to pass the relief package. That's what we were told. That's what he stood and told the press. And I'll be honest, Republicans were a little taken aback by this. Nobody had talked to us. Nobody had talked to the Senate GOP majority. If he was ready to call us back to pass legislation, don't you think maybe he should have picked up the phone? Maybe we should have heard about this before he said it from the podium. He was ready. Call us back the next day. Like, come on. It's just nonsense. This is such silliness. And of course, the next day we find out that the package that he was ready to pass was something that he and Majority Winkler had cooked up over the weekend. They didn't call Representative Baker, who had been working on this and actually had a plan. He didn't call Leader Dowd. He didn't call Leader Gazelka. It's nonsense. It's one person making decisions with no input from the people that he is affecting with every single decision. If the governor was forced to work with the legislature instead of doing everything on his own, do you think maybe we could have moved on this stuff? I guarantee that if the legislature was involved in the decisions, and frankly, I will tell you honestly, we're not given all of the information as a legislature. We don't know. We don't have all the data. We have some data. We know that movie theaters have been closed, and not a single outbreak in the entire country has happened in a movie theater. But movie theaters are closed. We have that much data. Like, this is such nonsense. But you know what? Maybe the data shows that some of this stuff that he's doing really does need to happen. We don't really know because he's not giving us the data. We don't really know. But what we do know is the way these things are happening is absolutely not okay. It is not the right thing to do. If we were together making the decisions that we had to make to keep Minnesotans safe, you better believe that the legislature would also be making decisions to protect our businesses, to protect the employees who are losing jobs because our businesses are shut down. If we didn't have one person making these decisions, we'd be thinking these things through a little more thoroughly. Ending the peacetime emergencies does not mean we end our response to the pandemic. Of course, we'll hear that lot, so, we're so irresponsible. We're not ending the response to the pandemic. We are ending one person's rule over that response. The legislature and the governor can work together to make sure our hospitals and healthcare workers have the resources they need to keep Minnesotans safe. We've done it. We've done it all the way along. Legislators are ready to work with the governor, and the governor should be prepared to work with the legislature. If we end the emergency powers, it'll force us to work closer together on these decisions, something that we've done incredibly well during this pandemic. Not only in the beginning of the pandemic, when we provided a lot of emergency relief and a lot of funding to make sure that our state was prepared, and we have been. We have been prepared. We don't have folks who haven't been able to get a ventilator if they need one. We have been able to take care of the people who needed to be taken care of. And certainly we've shown just this week, over the past few weeks, that we can do this. Tonight we passed a bill with amazing bipartisan effort by a team that was committed to working together to make sure that we were taking care of our small businesses and the people they usually employ, but have been forced to lay off because of this governor's shutdowns. But instead of working with us to come up with a business relief plan to figure out how to best protect Minnesota, he announces just sweeping mandates with just a few days' notice. This is not how we should be operating. How the governor has handled our businesses is a disgrace. Unfortunately, we all know that the Democrats in the House continue to defend the governor's powers. And I assume, as they've done in the past tonight, they're going to block our efforts to end the peacetime emergency. But I tell you what, House Republicans will continue working to end the emergency powers, restore the legislature's role as a co-equal branch of government. With the legislative session right around the corner, we've got less than a month now, there is no need for the governor to rule unilaterally and be the only person making decisions for millions of Minnesotans. Decisions that have had devastating effects because of how the governor has done this. Members, I strongly encourage you to vote yes on the motion to suspend the rules. Let's have a real discussion about this and let's take a vote. And Madam Speaker, I would request a roll call.
Representative New requests a roll call because there are not 15 members in the chamber. If you would support a roll call on this motion, please within the next 60 seconds send an email to hands@house.mn. Seeing 15 hands, there will be a roll call. The The member from Wright, Representative McDonald. The member from Monoman, Representative Green.
Thank you. Thank you, Madam Speaker. I know it's been late, and I don't like lengthy speeches. I think most of them get lost in the shuffle. So I'll keep this really short. But what to point out, that you just passed a bill that was labeled relief, but it wasn't really relief. It was just a Band-Aid. But we can do true relief today if we have the courage. The legislature has the power to end this. We have the power to stand for the people of Minnesota to end this horrible year with a positive conclusion. They say history will judge us, and history will judge us all. Now, people aren't going to remember our names in years to come, although they may remember the governors. They likely won't distinguish between parties. They don't care. They will remember 2020 as the year we failed. Failed our children, failed our seniors, and everyone in between. The way 2020 session has progressed should humiliate all of us. There's nothing positive to hang our hat on. We gave our power to the governor. When I doubt there's another time in history the statement, do nothing legislature was more appropriate. Some of you heard from voters in November about their distaste for the way things have gone. So for many of you, this will be your last vote. And do you really want your last vote to send a message that you were either unable or unwilling to do your job? When we are no longer here, we won't even be a memory. I hope no one within the sound of my voice is foolish enough to believe otherwise. But we can end these powers, and we can give one last win to the people of Minnesota in a year where they didn't see many wins. We can give them back their voice. And we need to let this come to a vote here tonight. So I hope that you guys will vote to allow this to come for a vote and end these powers and put 2020 to bed by giving people back their voice in Minnesota. Thank you.
The member from Wright, Representative McDonald. The member from Scott, Representative Cantrell.
Thank you, Madam Speaker, members. I rise in opposition of the motion this evening. Members, this has been a hard year. This has been a hard year for every Minnesotan, for everyone who lives in our country, in fact, for everyone across the planet. And these are unprecedented times. We have been faced with an array of challenges unlike those experienced by any of our forebears in modern history. And I just want to say, Madam Speaker, that I empathize with the struggles, as I know that we all empathize with the struggles that Minnesota families and business owners are experiencing and navigating through during this pandemic. But the governor's peacetime emergency powers, his peacetime emergency authority, has saved lives. And as another representative mentioned, people may not remember our names, but that's fine. As long as we prevent as many people from dying as possible, that is our responsibility here. And so as we assess a path forward, as we near the hopeful end of this pandemic, I urge my colleagues, I urge all members to oppose this resolution to end the governor's peacetime emergency authority tonight without replacement, to ensure that people facing eviction are not left unhoused in the middle of a still raging pandemic during the deadliest month so far in our state, to ensure that critical logistical capabilities that have been enabled by the governor's peacetime emergency are not undermined, as the first shipments of vaccines have been received in our state, and to think about how the future will reflect on the actions that we not only take here tonight, but as a summation of the actions that we have taken throughout the course of this pandemic. Because, members, I can guarantee that somebody who reflects upon the actions that we'll make here, who could have spent one more Christmas with an ailing family member, who could have spent more time with their immunocompromised child, who could have a chance to live, because, members, we did not undermine the tools that have been thus far so critical in ensuring that Minnesota continues to be a leader in slowing the spread and overcoming this pandemic. While our hospitals have neared dangerous levels of capacity, both in terms of critical care beds and ventilators, we have not surpassed this capacity, and this is critical because the governor's peacetime emergency authority enabled swift apolitical decision-making that further helped to alleviate the mounting strain that was accumulating within hospital systems across the state. I urge members to vote against the motion this evening, to continue to come together to evaluate how to continue to work in a manner that is conducive to helping to improve the quality of lives of Minnesotans, not only throughout the remaining duration of this pandemic, but in the following aftermath. But I urge members not to undermine a strategy that has been thus far as successful as could have been expected given these unprecedented times. So with that, Madam Speaker, I urge a no vote on the motion. And thank you to all of our healthcare workers who are, like Dr. Mann, are working and on the front lines this evening.
The member from Scott, Representative Albright.
Madam Speaker, members, you know, where I grew up, when we ran into someone we knew, a friend, acquaintance, just to start the conversation, you know, we'd say something like, "What do you know?" Now, in most circumstances, the response would usually be, not much. Or they'd comment about the weather or something about our local sports teams. But occasionally you get someone clever enough to shoot back something that make you laugh or share a story with you. You know, that's just being part of Minnesotan. But for the last several months, when I've asked people, "What do you know?" I've not been greeted with the same response. No, I'm getting responses of faces that are downcast, looks of defeat, weary eyes that speak to loss and hopelessness. I'm also catching a growing anger that is raw, with a visceral distaste for what this administration has made them endure. What do you know for sure? Let me share with you some actual quotes that I've received from people across this state. I'm losing my business. It's been in the family for over 50 years, and it's not even my fault. I have done nothing to deserve this kind of treatment. How many times is this guy going to change the rules on businesses without having a plan to help us out? My kids don't know what is going on at school, and frankly, neither do I. Can someone please explain to me what they've been using to predict this pandemic? Because it ain't worth crap. Why can't we seem to understand that the folks in the nursing homes and retirement centers are still dying? How dare he say that I can or cannot do anything in my home, let alone telling restaurants or fitness centers to be limited or closed at a time when I've got needs, serious needs that need life-saving support. And then I also get, I know what I'm not sure of. I don't believe anything about what they're doing. I don't trust what I'm being told. I don't think anyone believes in the rule of law anymore. I don't think they understand what it's like to live under their own rules. I've heard enough about what was used to create the great Minnesota shutdown. And it seems pretty much on a regular basis that he's changing the rules in order to fit his new narrative. Sure would be nice if we heard as much about what he intends to use to remove these chains. Just because someone is not afraid of this virus does not mean he or she doesn't believe in it. Each person understands the risks, but I will not allow it to paralyze me. Worrying cannot keep us safe. Maybe this governor should worry less about the virus and concern himself more with defending our constitutional rights. I'm not sure about these masks. Seems like it's just another way for them to wash their hands of their shutdown policies and put the blame on us for not wearing one. And then they can blame us for either wearing it or not and screwing things up. It's a pretty sad testimony when the folks who call Minnesota home have lost faith in the leadership of their state. It diminishes the import and the significance of the work that this executive branch carries out. But it also reflects badly upon this legislature and what we are responsible to do as well. From the middle of last March, when the governor declared a peacetime emergency under Chapter 12 of our Minnesota statutes, one of the biggest worries was how it would affect the kids. Sadly, they have faced more than their fair share of the storms surrounding COVID. But why? When there is a 1,000-fold difference between the mortality rate in older people 70 and above and the mortality rate in children. You know, to be sure, this is a great blessing. And if it were a disease that killed children preferentially, I'm sure we would all react very differently. But the fact is that for the youngest among us, this disease is less dangerous than the seasonal flu. And so far this year in the United States, more children have died from the seasonal flu than from COVID-19 by a factor of 2 or 3. So why is it that we seem so focused on not allowing them to be taught in the classroom? Students, especially the younger ones, are not designed to learn alone. So should it be any surprise that the lockdowns have had the psychological effects they've had, especially on young adults and children who have been denied their regular patterns of socialization? What you are doing is requiring young people to bear the burden of controlling a disease from which they face little to no risk. This is entirely backward. Distance learning, members, is failing our students. Look at the data. There is a middle school in this state that is reporting more students in the hospital from suicide attempts than from COVID-19 cases. You have school districts who have 40% of their students failing their classes. Not just doing worse, but failing. And now I've heard some suggest they'll stop just giving out Fs. We're losing students, folks. No, seriously, we are losing them. Like, you can't find them. They're not just cutting a class here and there. They're not showing up for school at all. And who does this affect the most? Low-income and single-wage earning families. Because mom and dad have to get to that job, if they have one right now, to pay the bills that never stop coming. And after school classes are non-existent. So no help from a friend or tutor with your algebra or English, let alone any team practice. This is the reality of these executive orders. What a sad legacy for a governor who hoped to be known as the champion of education. No one should dispute the seriousness that we need to take with this virus. But what about the other costs to our lives? Time and again, we have heard about the need to keep people safe, that we need to follow the science because people are dying. Yes, they are. And for many of them, that means dying alone, terrified about what is happening, with no family members or friends to support or comfort them. Is that how you want anyone to live out their last days or even hours? Telling someone they cannot console or grieve with their own family members is neither realistic nor healthy. And attempting to shame them into cooperating is so counter to our fundamental core values. And let's be clear about the history of lockdowns. Namely, they have never been tried before as a method of disease control. And moreover, these lockdowns were only part of the original plan. The initial rationale for lockdowns was we were told we needed them in order to get prepared for the coming tsunami of patients, to slow the spread of the disease and prevent hospitals from being overwhelmed. If this recent surge is that serious, then why not open up the other 1,000 beds you said would be available within 72 hours notice? Not to mention the 2 major hospitals that are sitting idle because of a lack of patients. But you know what is truly tragic? Knowing that people have stopped bringing their children in for immunizations against diseases like diphtheria, whooping cough, and polio, because they've been led to fear COVID-19 more than they fear these other deadly diseases. So much of the progress in slowing these diseases is going to be lost. And they are going to come back. Large numbers of Minnesotans, even though they had cancer, needed chemotherapy, have not come in for treatment because they were more afraid of COVID than cancer. How many others have decided to skip recommended cancer screenings? I'm told many in the scientific community expect to see a rise in cancer and cancer-related deaths because of this cloud of fear. Not only cancer, but deaths from diabetes due to people missing their diabetic monitoring. And probably the most terrifying statement made recently is that a recent CDC survey found that 1 in 4 young adults, 1 in 4, between the age of 18 and 24, had seriously considered suicide. Even with the approval of a vaccine, we will still be relying on herd immunity as an endpoint for this epidemic. To be sure, the best strategy is still not to let people die. But why isn't the primary strategy to protect those most susceptible? We know who the vulnerable are, and we also know who are not. Given the emergence of all these therapeutic options you hear about, and now the availability of a COVID-19 vaccine, why shouldn't we be allowed to conduct our lives, open our schools, and live our lives normally alongside the unavoidable reality that there will be new infections and more hospitalizations? We talk about the economic harms of lockdowns and how they're regularly, those that speak up about them are accused of being heartless. Economic considerations are nothing compared to saving lives, we are told. But the tragedy of the human toll these executive orders have had on both a personal and business level are irrefutable. Think about the number of Minnesotans, young and old, who will starve this year as a result of the economics caused by these lockdowns. Minnesota has worked so hard to lift so many out of poverty. And yet this year, I would submit to you, we will reverse course in those efforts. Again and again, hospitality and entertainment venues, as well as other small businesses all over the state, have spent heavily of their own resources to comply with the changing governmental regulations surrounding COVID-19, including buying personal protective equipment for staff and improving their ventilation systems to assure patrons to their establishments that they feel safe. But now they're being punished again. Small business owners who permanently shut down will lose the equity they have worked to build up over years or even generations. And the result of those permanent closures will create even greater social and economic inequality, as well as an increased burden on social programs. Has anyone in the executive branch contemplated how to prepare for that? Has anyone considered the workforce that will be lost? Kind words and a sympathetic ear are small comfort to those suffering the loss of a life spent building up a business, a retirement account, creating job opportunities for others, as well as investing in their local community. This is just as much a tragedy as is every life lost to this virus. They've been talking about calling this the K-shaped recovery and that things are getting better for our state. But what a lot of people don't remember is it's the result of massive federal government COVID-19 relief bills. These lockdowns by executive order are punishing the very people needing help the most: low-income wage earners and their families. They say that a couple of the symptoms folks comment about if they've had COVID or a loss of taste and smell. I think people across the state are starting to tire of the smell of this current strategy And quite honestly, they've lost their taste for this governor's declaration to single-handedly try to save them from the impossible. The executive branch's directives are not about what they do, but about making sure we're all socially representing that we're all in this together. Something I hear this governor say all the time. I don't think the anecdotal evidence supports that we are. This governor ran for office on the slogan, "One Minnesota." But do the actions match that rhetoric? To almost everyone I talk to, they're not buying it. At best, Governor, you might want to start using "my Minnesota," since you seem to be the only one who has the authority to affect how we live our lives right now. But it isn't your Minnesota, Governor. You should remember that. This is our Minnesota, Governor. Our Minnesota. Thank you, Madam Speaker.
The member from Hennepin, Representative Morrison.
Thank you, Madam Speaker. Members, today is an extraordinary day and an unprecedented year. The American death toll from the COVID-19 pandemic now exceeds the American combat death toll during all of World War II. The first 100,000 deaths were confirmed in the end of May. It took 4 months to reach the next 100,000 deaths and just 3 months to lose the last 100,000 Americans. Given the high number of infections, public health experts fear that we will lose another 100,000 Americans in a single month. That is a staggering and accelerating loss of American life. The emergency is not over. The proportion of Americans who die about 3 weeks after infection remains at about 1.7%. With daily infections approaching 200,000 cases a day, that means we still have many deaths ahead of us. We still have to anticipate overburdened emergency rooms, hospitals, intensive care units, and healthcare providers and staff. The emergency is not over. Today is also extraordinary in that the first vaccines have begun to arrive at American hospitals, including here in Minnesota. There is light at the end of this long, dark tunnel. There is hope for our lives to return to the rhythms we are used to, and hopefully perhaps even to a better new normal. But it will take some time still. We're not there yet. The emergency is not over. I urge a no vote. Thank you, Madam Speaker.
The member from Sibley, Representative Gruenhagen.
Oh, thank you, Madam Speaker. I'll be brief. We all want the medical data and facts. And I'm just going to read a few comments from the Great Barrington Declaration. I think most of you are aware of it, but it has over 43,000 now signatures of eminently qualified medical professors or professionals, including the medical department heads from Stanford and Harvard. Now, there's a similar declaration over in Europe that was started separately and has thousands of medical professionals signing it too. So the short little thing I'm going to read here is a direct quote, okay, out of their declaration of these 43,000 medical professionals, including the heads of the medical department of Stanford and Harvard. Here's what they say, quote, adopting measures to protect the vulnerable should be the central aim of public health responses to COVID. Those who are not vulnerable should immediately be allowed to resume life as normal. Simple hygiene measures such as hand washing and staying home when sick should be practiced by everyone to reduce the herd immunity threshold. Schools and universities should be open for in-person teaching. Extracurricular activities such as sports should be resumed. Young, low-risk adults should work normally rather than from home. Restaurants and other businesses should open. Arts, music, sports, and other cultural activities should resume. People who are more at risk may participate if they wish, while society as a whole enjoys the protection conferred from the vulnerable by those who have built up herd immunity, close quote. They also oppose lockdowns and they oppose masks. Again, this is not my opinion. It's an opinion of over 43,000 eminently qualified medical professionals. And members, I have a secretary part-time, one of them, who works up at a parochial school. They have not shut down. They do in-person classes, and they've got applications that they cannot even let into their school. However, they did have a COVID outbreak. So what did they do? They closed down for 10 days about. Nobody directed them, no directive from government. Their local administrators and people in charge made that decision. And then after 10 days, my secretary went back to work again up at the parochial school. Local control. Now, I know the people in the public schools are just as smart as the people in the parochial schools. Just unshackle them. Let's allow our children to go back to school and give them local control. If they have an outbreak, they can make the decisions to protect the students and the staff, especially students and staff if they have underlying health problems. You know, the achievement gap is being greatly aggravated through this. And, my good friend, Representative Albright, has covered a lot of that. But at my local school district that I attended the meeting, MDE has reduced the passing grade to 50%. We're failing our students, not based upon the medical facts and data, but based upon more of a political agenda. We want to work with the governor. I think he wants to do what's best also, but we need to do it together. And I think by voting for this, we show the governor on a bipartisan basis that we can, we will work with him on this. It's Christmas, members, you know that. By the way, Merry Christmas. It is a federal holiday, by the way, so you can say Merry Christmas in schools, public schools, or public buildings, because it's a federal holiday. Anyway, that's another point. But let's give our children the gift of, during this Christmas season, of opening their schools, ladies and gentlemen, by supporting this resolution. And again, let's drop our labels of a Republican and Democrat, and let's be Minnesotans on this, okay? Sometimes I wish there weren't Republicans and Democrats, only Minnesotans at the legislature. And maybe, I don't know if it would help or not, but maybe it would. But I like a lot of you on the other side of the aisle. I respect you and know you want what's best. But please, members, let's send a brief message to the governor that let's work hand in hand on this. And I think we will be surprised at how much unity can be accomplished in our state if we work together. Thank you, members. And I hope you can support this measure.
The member from Candy Ojai, Representative Miller.
Thank you, Madam Speaker. And in respect for people's time, and I know drawing long on and on and on, I'm going to speak very briefly here, and then when it comes to my motion, I'll withdraw that. One quick aside, something was said earlier, very quickly, and I have great respect for Representative Pinto. He came in when I did. We've worked on things together. I think we have mutual respect. So this is no regard to him. but we kind of pick up terms around here, and one of the terms that's been used very clearly very often is essential and non-essential workers. And I'd like us to find a way to move away from that. It's degrading, it's divisive, and it gives value of one person over another. And I think we can all agree that those are not good things. I can't tell you how many times where people have come to me and said, why do I keep getting called a non-essential worker? That's just, so anyway. To this motion, every time we do this motion, we've done it several times, we've done it in different formats. I had a slightly different format that I'm going to address very briefly, just to make reference to it. Afterwards, I always get at least a couple people that say, Representative Miller, why are you trying to make this situation political? I've heard it on this House floor. We're politicizing this by bringing up this motion. And I find that very interesting because if there's been one good thing that's come out of this past year is I've dove in deep, and so have several other people, into civics. Representative Erdahl wants us to learn civics, and I think that there's many good lessons that can come out of this. And whether it be a lawsuit or it be these ending emergency powers through a resolution or whatever, I keep going back to this is what our Constitution says we must do. And we talk about separation of powers. We talk about roles of each part of government, equal value in each part. And yet whenever we bring that up, we're degraded as, I've been told in this room, I basically just need to be quiet and do what the governor wants me to do. I'm sorry, folks, that's not my role. I was not elected to do that. I'm elected to work with the governor, but as an equal partner in this. One thing that I found amazing is there actually was accidentally some bipartisanship here today that wasn't, constructed, that wasn't proclaimed as why we're doing things. It was bipartisanship, and it was the word vaccine. I've heard things like with the vaccine, we're seeing light at the end of the tunnel, or things are coming to an end, or things are going to improve from this point on. And I agree. I don't think that a vaccine is necessarily the solution to everything. But I will tell you that what we're being told consistently is this vaccine has 95% efficacy. I've heard that consistently. No one seems to challenge that. Now, that's not 100%, but my wife is a nurse, and she said she was surprised by that because most vaccines don't have even close to that level of effectiveness. I think the number, and I might be wrong with this, it's late, but I think for like when you do your influenza vaccine, that's about a 60%, sometimes lower depending on the year in which strains show up. So this is very exciting things, but it also leads me to challenge the governor. These are emergency powers. I know we've said that 100 different ways, but these are powers that are intended to just be briefly inserted to execute on the most critical things for a period of time. Now, we've had a lot of argument about what that period of time is or how long it should be, but if we're moving towards the end, that's the transition that I guess I would say to the governor, which I'm sure he's watching at this late hour. This is the time for the governor to transition us back into the way that we were designed to govern in the state of Minnesota. It's nothing more complicated than that. And for the people who reject that or say, but we need to do this longer because we need to save people's lives or because we care or things like that, we can do the things that we can do in a normal government. And in my opinion, by saying, no, we need to have one person that's doing all this, then we're basically either doing one of two things. We're either disrespecting the government that we have created for ourselves in this great nation, or we no longer think that it's a way to run government. And I challenge everyone in this room and people listening that are going to be voting on this. Again, as we say, we kind of know where this is going. But I'm going to tell you, what we do right here tonight. I know it's late and I know everyone's tired and they say, well, this isn't going to pass anyway, so why are we doing this? I'm doing this because I fight for what I believe is right, and that's what I believe I've been elected to do. And as long as I have breath and as long as I have a vote in this room, I'm going to fight for what is right. And I expect everyone else to do the same as well. Thank you, Madam Speaker.
A member from Olmsted, Representative Quam.
Thank you, Madam Speaker and members. And this discussion and this situation we're in reminds me of why I think we're so fortunate to live in Minnesota. One of my earliest memories was a Christmas Eve when a well went out and all the neighbors came together to assist that family. Growing up, you didn't think about it. If somebody was stuck in the snow, you got out and helped them. And frankly, what I think we're debating here is having compassion for the governor, helping the governor. How many months of the weight on his shoulders that in that burden is difficult for any group of people, let alone focused on a single person. We as a group can bring up many possible applications and things that can assist people. It's been touched on, so many people, the overdose rate, suicide, death rate, so many repercussions are hitting people other than COVID. And as a group, and as Minnesotans, we should be pulling together to help the governor bring up solutions that will work in different communities. One size doesn't fit all. And we have the capability as a team to have those options, to bring that forward, to work together and take the burden off of the governor. I can't imagine what it's like when early on we had such a huge portion of deaths from the long-term care facilities. And what could we have done better? If you've got a group working together, you've got options. You've got that discussion. You got the what if and all the viewpoints coming together for solutions. And anyone that's been in the legislature for any length of time realizes unintended consequences are hard to figure out. But we together, as legislators, as Minnesotans, can help avoid these unintended consequences. We can provide the options, the choices, and the local solutions that will save more lives, that will alleviate so much suffering that our communities and neighbors are going through. It's hard for one person not to just focus on the COVID and to see the broad perspective of all the consequences of any of the choices, whether it's a lockdown or I was shocked. We got vaccine in Minnesota. We got it locally in my county. And I heard that we're going to take a week before we start dispensing it because we need training. And we've got the #1 in my county, the #1 medical facility in the world. And I know they have people that they could have started applying this vaccine to the key groups from arrival. You get a couple hours to warm it up and some processing. But we have that expertise. And I know other hospitals have that expertise. But if we had been able to help the governor months or weeks before, we could have had a training program in so we could be vaccinating people this next week instead of holding off. And I feel bad that we have not softened the load on the governor's shoulders. So I ask that we as a group step forward, assume some of that burden, help out with this problem by passing this, stopping the emergency powers, and standing up and doing our job that we were elected to do. So I hope we can agree and allow the vote. And my understanding, if I remember correctly, the other chamber had bipartisan support on this. A pretty good sized group of people voted for this. So I just ask you to join me in voting to allow us to vote on this. Thank you.
The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker and members. Well, I've been listening to this for quite a long time, like all of you have, and it's been hard at times, as it usually is when we debate this, to sit quietly and not say some things. But I do just want to respond to a few things that people have said. I mean, first of all, everybody knows that 2020 sucks. And I think it was Representative Garofalo who said that quite clearly. The global pandemic sucks, and it's hurt a lot of people, and it's still hurting a lot of people. And some people have been hurt to the degree that they are dead, or their family members are dead, or they have long-term complications from a case of COVID. So those things are very real. This is a very real thing, and it sucks. But I hear my Republican colleagues all over the map, and you have been all over the map, and your party's been all over the map through this whole thing. And part of the problem here is that you cannot get your act together deciding how serious this is and what needs to be done. So I hear from some people that we don't need masks. Masks don't work. Herd immunity, we're still on this herd immunity thing. Well, the way you get herd immunity is with a vaccine. And thank God, it seems like that's what we're going to be able to do pretty soon. In terms of what this motion is about, what it's always about is, are we going to take away the governor's emergency powers and then replace it with what? So it would be great if we could all work together, as many members have said, to actually do something here and fill the void and make the decisions and bring in the kind of information from all over the state that's what our legislature does. That's what legislatures are good at. But it's become very clear throughout this whole thing that wouldn't really work. We can't do group decision-making in this situation because, for one thing, we've got people who are bringing in the conspiracy theories here and who are not focused on the health issues here and who are going to make this a political thing. This can't be about what people want. We all want the virus to be gone. We wanted the virus to never happen. We don't want anyone's business to be hurt. We don't want anyone's child to be hurt. We don't want any kids to be out of school. None of us want that. But we don't have a program to fix everything, and we haven't had it. And I just want to remind people, those of you who are like, let's just work together. Let's just work together. Well, first of all, if there was not a pandemic, if the governor was not using the emergency powers, we would not be in session. We would not be holding this session. We would not be meeting again until January. And we will be meeting in January, even though it's going to unfortunately still be remote. And there will be plenty of opportunity to work on things. So it is really mind-boggling to me when I hear people say, oh, we don't have a role. We haven't been able to do anything. And yet here we are, and we have just passed a rather large, important bill to help Minnesotans. Proof that there is something we can do, that our role has not been gone. But we as a legislature cannot be making these decisions like, should Minnesotans be required to wear a mask? Because those can be unpopular decisions, And yet they're decisions that have to be made in order to save lives. So again, is the governor perfect? Has he made wonderful decisions every time? Does he always do the thing that turns out to be the best? Of course not, because everybody, every scientist, every community has been learning as we go through this thing. And yeah, if we were really on the ball and we could really have our input and people, we might be able to improve those decisions. I agree with Representative Quam. I'm a person who believes in this group process. I think hearings are great. This is how we should do things. But it hasn't been possible, and it's still not going to be possible until we're back in session. So I just want to give you one big example that just happened about why this can't be in the legislature's hands. You know, one of the bills we've been working on through this period of time to try to get ready for today was a bill on long-term care funding. And we had a hearing on this in my committee recently, right? And we were working with the Senate. It's not the most wonderful process. It should be a more public process. It is what it is. We're working with the Senate. We're working with House Republicans. We're working with Senate Democrats. And then what happens? Suddenly we're having a meeting and Senate Republicans just, can't come. And then House Republicans, can't come, just can't show up for this. And I want to tell you, those of you who've been talking about how wonderful it is if we could just protect the vulnerable, what this bill was, this is like the core of everything we should be doing here. Our federal funds are going to end December 30th. And oh my God, suddenly we're not going to have funding for vaccinating people in long-term care. We're not for testing, continuing our testing program in long-term care. We were going to fund teams of people to go in and help with infection control. We were going to have a nurse triage line to help deliver test results and make sure that people get their results and when they're positive. And perhaps most importantly, emergency staffing for long-term care, because the biggest problem we're having in our hospitals too, and this goes to this empty hospitals thing, it's the staff. The staff are getting sick. The staff are needing to isolate. And so in long-term care, you get these situations where the staff get sick and there's a crisis. And so our Department of Health has a program, and our emergency operations center, they have a program where they have contracts with teams of staff who are available to come in and fill in for those up to 2 weeks for those other staff to take care of themselves and not get the residents sick. And so we need money for this because the federal funds are going away. And so what happens? The Senate Republicans stonewall us, decide not to do it. Hasn't been told to me why. And of course, House Republicans too, just not going to meet, can't meet. So this complaint that, you didn't call me, just falls kind of hollow to me. Very hollow. Because we should have been passing a long-term care funding bill tonight, and I don't know what's going to happen now for the next couple of months or however long it's going to take if the federal government doesn't step it up and fund these critical things to keep these people safe, the very people that some of you think they're the only ones who need to be protected. So I think you've illustrated very nicely tonight why this doesn't work, why it can't work. And thank God we've had a governor who's been willing to take the heat. And some of the time he's probably been wrong. But by God, at least he's focused on trying to keep the case numbers down and trying to keep people alive so that we can get to that vaccine and this thing will taper down with the least harm, with a lot less harm than would have happened had he not been there. So that's all I'm going to say. It is very late. Thank you for letting me talk. And I urge everyone to vote no on this motion and just, keep hope alive. This thing's going to be over in a few months. We all hope. Thank you.
The member from Clearwater, Representative Grossell.
Thank you, Madam Speaker. Thank you, members. And thank you, Representative Liebling. You just proved so many points that everybody was making earlier, and some of the points that I made earlier. Name calling that the left resorts to immediately. The shaming, it continues. And it's just, you know, every time somebody on the right, somebody in the GOP, or anybody disagrees, you're a conspiracy theorist, or you're not educated, or you're not something else. So thank you. Thank you for making sure that everybody hears what the left really thinks about anybody that's in opposition. And you know, you hear it continuously. But I'll be short. I'll be short in this. You know, I was just going to be very brief and ask people just to take into consideration how long this has been going on. You could look down. One thing that Representative Liebling was correct on was 2020 was a horrible year, and it is a horrible year, but one that can be, or should have been, dealt with differently. Everybody says, well, what would you have done? Well, for one thing, wouldn't have locked everybody up, because we all knew the survival rate from this virus within a reasonable amount of time could have staved off a lot of this economic tragedy, could have staved off the increases in suicide cases, could have staved off a lot of the violence that has occurred, could have staved off a lot of things had we not been fed the BS about the new normal. I, for one, like the old normal, where Minnesota citizens were working and thriving and living and enjoying each other. And that is the normal that I'm going to keep working to get back to. Because if the way things look right now is the new normal, how can anybody want that? How can anybody want that? So again, you know, all you have to do is not be silent and not be inactive. Because as a very caring and loving individual, Dietrich Bonhoeffer said, and I'll quote him, "Silence in the face of evil is itself evil. God will not hold us guiltless. Not to act is to act, not to speak is to speak." So each one of us, myself included, we have to look in the mirror every day. Am I going to be silent in the face of evil? Am I going to freeze and not act in the face of evil? No. I'm going to make sure that I speak up to defend those who cannot defend themselves, to protect those who cannot protect themselves. Look down through this year. Look at the trail of destruction that has been left behind due to indecision, no decision, and just plain incompetency. I will not stay silent. I will not stand still. Some people say, why do we keep fighting? Why do we keep trying to get the authority out of the governor's hand? Some people may want to give up and not continue that fight. but do not talk down or look down their nose at those of us who are willing to fight. So I'll leave you with this. From the book of James, 4:17. The one who knows the right thing to do and yet does not do it, to him it is sin. And that is for each one of us, myself included, to look in the mirror as you look at this, this piece that's in front of us. You have a decision to make. You know what is the right thing to do. And the decision you make is between you and God. And I pray that you make the right one. Thank you, Madam Speaker.
The member from Carver, Representative Nash.
Well, thank you, Madam Speaker and members. I got a letter a piece of mail this week from Patrick Murphy. I got a copy of my next election certificate, and I got to tell you, this is the fourth time that's happened, and every time I just stare at it in amazement and wonder, because that is a physical representation of the fact that I am the voice for a certain number of people at the legislature. And I think that's pretty cool. And in talking to some of the people who I represent, they often ask, what are you doing to change this, Jim? What are you doing to affect a change? And I tell them that right now the legislature is really kind of an afterthought. And they say, well, how do I get a message to the governor? They said that would normally be you. You get my message introduced to the people who make decisions down there in St. Paul. And we are grateful for your effort. We're grateful for your work. And we appreciate the fact that you listen and you take calls and you do emails with us. And you always are very quick to get back to us. And many of them tell me, I've called the governor. I've sent emails to the governor. I've been pushed down to staff and I get a form email, but I never actually talk to anybody down there that's making decisions. And they're getting pretty mad. They feel like they don't have a single voice down there because they know that either myself or Senator Jensen or people who have called me that happen to be Representative Bowe's constituents, they don't have anywhere to go. No one's taken their call. And I'm hearing from businesses much the same thing. I have some dear friends, Brian and Cheryl Vargo, who work super hard to keep their business chugging along. And they've told me that when it comes time to talk to the administration, it is radio silence. I have other folks, a lady named Nicole, who's called me and emailed me to talk about why can't we let their kids play sports. They've pointed out, and I agree, well, we've got professional sports. We see that. And we have college sports. We've seen that. But why aren't we letting the high school kids play sports? If there's some magical transformation that happens between becoming a professional athlete versus an amateur athlete or a high school athlete, they're literally wanting to know. No one's telling them from the administration. They're just snapping their fingers and saying, nah, we're not going to do that. I've mentioned earlier, I've talked to dozens and dozens of people who own breweries and distilleries and wineries and meaderies and cideries. And they have said that they have tried to get messages into the governor to no avail. No one's listening. No one's returning phone calls. Just complete radio silence. And they asked me, Jim, what the hell is going on down there? Why can't I get someone to call me? I've gotten calls from these folks all over the cities. I was down at Fulton Brewery with a bipartisan group of legislators. And they said, Jim, you're way the heck from the sticks. Now, some of you will laugh because it's Waconia versus or down to Minneapolis, so not that far, but they look at it as I'm way the heck out here. And they say, you'll come down, you'll come for a visit, you'll listen, you'll take a phone call, you'll jump on a Zoom call, but our governor can't even be bothered to get back to us. But he tells us, the House DFL will tell you that he's the only guy who can get this right. And I just think that's hogwash. I think that all of you probably have now gotten your photocopy of your election certificate for those that are coming back or newly elected that are listening. I would encourage you to use it, because the proper role of the legislature is to be a co-equal branch of government. And for anybody who wants to say that the governor is the only person who can make these decisions, that he is the fount of all wisdom, that he knows and only he can do the things that have to get done because it has to move so rapidly. Well, I would point out to you that the number of executive orders in recent months has been sparse. So don't tell me, don't have the guts to tell me that only he can do that. And don't conflate my opposition to the governor's executive powers to my denial of COVID being an actual thing. We've experienced it here in our house. Everyone's fine, thank God, but it's a thing. It's contagious. You take smart steps to mitigate it. You make sure that the people who have it are well cared for, and that the people who are caring for those with it are also well cared for. But don't think for a minute that the average person is buying your stonewalling for the governor to become a dictator for another month, that they believe what you're selling. They don't. You know, I talk to a lot of folks that have owned or own exercise places. Jen at Crusher CrossFit, Pat at Sisu CrossFit, and Megan at Shape It Up Fitness here in Waconia. I've met with them. I've worked my tail off to try to get messages to the governor on their behalf. And if you look at the numbers, if you look at the math, you all profess, oh, the numbers will tell the story. Well, if you actually believe what you're saying, you would have recognized that the infection rate from those places is very small. And that those places also perform an amazing service to people by keeping them healthy. And you've heard me tell this story before, and I'll tell it again briefly. Jen at Crusher CrossFit told me that she had a woman who was morbidly obese, and she had the guts to go down there and exercise and lose weight and get on a pathway to become more healthy. And in the first shutdown, she took huge strides backwards, began gaining more weight. How many more people are we going to hear about that are doing just that thing? That they were on a pathway to both physical and mental health. And then with very little warning, the governor shut us down a second time, ignoring the math on many of these places. And now folks quite literally will die, not from COVID, but because they lost hope and they lost their battle perhaps with obesity. They lost their battle with other mental health issues because now they have no outlet to do so. Or I think about the students that are going to school. Most of you know I have 6 kids. 4 of them are still in school. And if we have Zoom meetings during the day for the legislature, I usually dial in because the broadband or the internet here at the Nash House is getting pretty thin by that part of the day. And it's not good. Kids are not doing well. We have to buck them up and keep them energized, and it is not that good. I am beginning to have grave concerns about the students that I represent, and the students across the state of Minnesota are languishing because they just look at a screen all day and they're quote unquote learning. It's absolutely deleterious for their mental health and their long-term learning. I think that they're basically taking a gap year now instead of perhaps after high school. I look at all these other businesses that are on Main Street, and I think, I voted no against the bill because I didn't think that it was doing enough. It was kind of, as others have said, sprinkling crumbs in front of the businesses. And I understand that it was an honest attempt and it was a good attempt. And I look at some of the businesses that I know the owners of, and I get phone calls from them, and they say, Jim, I don't want a damn check. I want to open up. If they trusted me in the first post-lockdown, and they can show that nobody got COVID from them because they were going above and beyond to be safe, why can't they stay open now? Why can't they do what they need to do? Why can't they sell the things that they've either worked hard, or the things that they build, or open up the breweries and the distilleries, the things that people are investing their lives in? Let them sell that, because guess what? The government still wants their tax revenue. If you own a building, even though you're not cash flowing your business to cover that, guess what? They still want their check. These people are losing hope. And I am a very optimistic guy. I think sometimes it drives my wife crazy. Many of you have seen the picture in my office of me getting my butt kicked by a bull. Even after that event where I broke 3 ribs and dislocated my shoulder, I was still pretty upbeat and optimistic. My wife said, how you feeling? I'm like, oh, it's pretty good. It was a great experience. It's a good day. And I was in intense pain, but I'm so optimistic. But a lot of folks here are not optimistic. They're losing that drive. They have no motivation. They wake up depressed. They wake up sad. And I want to reiterate this. So many of you have been defending the fact that we cannot overturn the executive powers simply predicated on the notion that the governor is the only person that can do this. And I say that is crap. We have the ability as legislators to do amazing things. I mean, here it is. It's late in the morning, which is still prime time for me because I don't sleep. It's 1:47 in the morning. We can still legislate. We can still do things. We can move bills forward. If we have to, we can do it quickly. But these policies that are getting made, even some of the policies that have come forward and passed tonight, were not done through the committee process, and I find that abhorrent. In fact, I had a bill that I've introduced now for the last 2 special sessions to simply allow people to dial in either via Zoom or telephone and offer testimony, which we have not seen necessarily in all of our meetings. That bill did not come to the floor tonight, and people are noticing. The legislative process is important. The legislative process is valuable. All 201 of us down there were sent down there by people who said, that's the person I want to be my voice in government. But we're not their voice right now. There's one guy. And it is time to put an end to his reign if you can stand up and just vote green. And this is not the end of the treatment of the pandemic. We don't believe that. Don't think that the Republicans say, oh, once we take away the governor's executive powers, no one's going to be dealing with COVID stuff. We're ready and willing to jump into the fight and do our job and be the voice of the people in Minnesota and to represent them in their government. So have the guts. That business name I told you, SISU, that means guts. Have the guts to do the right thing and vote green. Thank you.
The member from Hennepin, Representative Robbins.
Thank you, Madam Speaker and members. I just have 2 quick points. First, earlier tonight, a member said that the governor's strategy was as successful as possible in these unprecedented times. And that struck me as probably not true. So I just did some checking and had also been working on this earlier in the day, but it motivated me to keep going. So I just want to highlight, for most of our surrounding states, including us, November was the month with the highest number of cases. Wisconsin's peak was November 18th with 8,510 cases. As of today, they're down to 2,965. North Dakota's peak was November 14th, 2,270 cases. As of today, they're at 281. South Dakota's peak, November 27th, 2,138 cases. As of today, they're at 631. Iowa's peak, November 13th, 5,489 cases. As of today, they're at 1,240. Minnesota's peak. First, Minnesota on the 18th of November, the day of the last shutdown order, 5,094. The peak was November 28th, 9,022. The highest peak in our surrounding states. Today, we are still at the highest, 3,425. So there are a variety of strategies. Not everyone is wide open like South Dakota. Other states are taking some other mitigation measures, but we are probably among the strongest taking steps to do shutdowns and lockdowns and curtail activities, and we have the highest numbers. So I just want to bring that data forward so that members are understanding that this strategy is not probably the most successful we could be using. Secondly, all of my colleagues have done a great job talking about the stress on students and families, and I just don't want to end without, again, we've also talked a lot about feeling like our voices are not heard. I know I've said that many times on this floor. So I'm trying to be a voice for my constituents tonight. And in the last 3 weeks, I have had 3 different families email or call me crying because their student has been researching online or talking about suicide ideation. And this was from this morning. I am writing with urgency today, this is one of my constituents, to ask you as the one who represents my family and I to do whatever is in your power to end this lockdown. I have 4 kids at home who are really struggling right now. I'll not say the age, but teenage child had the courage to tell us she is having suicidal thoughts. She was thriving before all of this. She did well in school. She was getting attention from colleges to play volleyball and was overall a very happy person. Now she is barely passing school and can't play volleyball. All she wants to do is watch TV and look at her phone. Sorry, I can't quite read it. I'm begging you for the future of my family to fight for us and be a voice of reason, end the emergency powers, and end this shutdown. And this is just one example, members. The consequences of this shutdown, it's not been 3 weeks. It wasn't 3 weeks just to keep the hospitals open. We are at 8 months, going on 9 months. The long-term consequences of this for our students, academically, emotionally, and physically are terrible. And it will take many more months than the 8 months we've been in for them to recover and regain what they have lost. So I'm begging you to please, the situation we have, as I showed you from the numbers, this isn't the only way to do this. So it's time to try a different strategy. Let's end the shutdown and let's end the governor's emergency powers tonight. Thank you.
The member from Hennepin, the Majority Leader, Representative Winkler.
Madam Speaker, members, I will ask you to vote no once more on an irresponsible Republican motion to remove Minnesota's defenses against a deadly virus.
The member from Chisago, Representative Newt, to your motion.
Thank you, Madam Speaker. I would encourage members to vote yes.
Seeing no further discussion, the clerk will take the roll on the motion to suspend the rules.
Acom. Acom. Albright.
Albright, aye.
Albright, aye. Anderson.
Anderson, aye.
Anderson, aye. Backer.
Backer, aye.
Backer, aye. Bonner.
Bonner, no.
Bonner, no. Barr.
Barr, aye.
Barr, aye. Baker. Baker. Becker Finn.
Becker Finn, no.
Becker Finn, no. Bennett.
Bennett, aye.
Bennett, aye. Bernardi.
Bernardi, no.
Bernardi, no. Bierman.
Bierman, no.
Bierman, no. Bow.
Bow, aye.
Bow, aye. Brand.
Brand, no.
Brand, no. Cantrell.
Cantrell, no.
Cantrell, no. Carlson, A.
Carlson, A, no.
Carlson, A, no. Carlson, L. Carlson, L. Christensen.
Christensen, no.
Christensen, no. Claflin.
Claflin, no.
Claflin, no. Considine.
Considine, no.
Considine, no. Daniels.
Daniels, yes.
Daniels, aye. Doubt.
Doubt, aye.
Doubt, aye. Davids.
David's, aye.
Davids, aye. Davney.
Davney, no.
Davney, no. Dean.
Dean, no.
Dean, no. Damath. Damath, aye. Detmer.
Detmer, aye.
Detmer, aye. Dreskowski.
Droskowski, aye.
Dreskowski, aye. Eklund.
Eklund, pass.
Eklund, pass. Edelson. Edelson. Elkins.
Elkins, no.
Elkins, no. Erickson.
Erickson, aye.
Erickson, aye. Fabian.
Fabian, aye.
Fabian, aye. Fisher.
Fisher, no.
Fisher, no. Franzen.
Franson, yes.
Franzen, aye. Freiberg.
Freiberg, no.
Freiberg, no. Garofalo. Garofalo, no. Gomez.
Garofalo, aye.
Garofalo, aye.
Gomez, no.
Gomez, no. Green.
Green, aye.
Green, aye. Grossel.
Grossel, aye.
Grossel, aye. Gruenhagen.
Gruenhagen, aye.
Gruenhagen, aye. Gunther. Gunther. Haley. Haley, aye. Halverson, excused. Hamilton. Hamilton. Hanson.
Hanson, no.
Hanson, no. Hassan.
Hassan, no.
Hassan, no. Hausman, excused. Heinrich. Heinrich. Heinzman.
Heinzman, aye.
Heinzman, aye. Her. Her. Hertog.
Heinrich, aye.
Her. Hertos.
Hertos, aye.
Hertaus, aye. Hornstein.
Hornstein, no.
Hornstein, no. Howard. Howard.
Howard, no.
Howard, no. Hewitt.
Hewitt, no.
Hewitt, no. Johnson. Johnson. Jordan.
Jordan, no.
Jordan, no. Jurgens.
Jurgens, aye.
Jurgens, aye. Keel.
Keel, aye.
Keel, aye. Cleavorn.
Cleavorn, no.
Cleavorn, no. Cagle.
Cagle, no.
Cagle, no. Katiza Wattoon.
Katiza Wattoon, no.
Katiza Wattoon, no. Kosnick.
Kosnick, aye.
Kosnick, aye. Krisha.
Aye.
Krisha, aye. Kunish Podine. Kunish Podine. Lehman.
Kunish Podine, no.
Kunish Podine, no. Lehman. Lee.
Lee, no.
Lee, no. Lesh, excused. Liebling.
Liebling, no.
Liebling, no. Lean.
Lean, no.
Lean, no. Lilly.
Lily, no.
Lilly, no. Lippert.
Lippert, no.
Lippert, no. Lislegard.
Lislegard, aye.
Lislegard, aye. Long. Long, no. Lucero.
Lucero, yes.
Lucero, aye. Lewick.
Lewick, aye.
Lewick, aye. Mahoney.
Me.
Mahoney, no. Mann, excused. Mariani.
Mariani, no.
Mariani, no. Markwart.
Markward, aye.
Markwart, aye. Mason.
Mason, no.
Mason, no. McDonald. McDonald. Mecklin.
Meckland, aye.
Mecklin, aye. Miller. Miller, aye. Moeller.
Moeller, no.
Moeller, no. Moran. Moran. Morrison. Morrison. Munson.
Morrison, no.
Morrison, no. Munson. Munson. Murphy.
Murphy, no.
Murphy, no. Munson.
Munson, aye.
Munson, aye. Nash.
Nash, aye.
Nash, aye. Nelson M.
Nelson M, no.
Nelson M, no. Nelson N.
Nelson N, aye.
Nelson N, aye. New. New, aye. Nor.
No, no.
Nor, no. Nornis.
Nornis, aye.
Nornis, aye. Novotny.
Novotny, aye.
Novotny, aye. O'Driscoll. O'Driscoll.
O'Driscoll, aye.
O'Driscoll, aye. Olson.
Olson, no.
Olson, no. O'Neill.
O'Neill, aye.
O'Neill, aye. Pulowski.
Pulowski, aye.
Pulowski, aye. Purcell. Purcell. Petersburg.
Petersburg, aye.
Petersburg, aye. Pearson.
Pearson, aye.
Pearson, aye. Pinto.
Pinto, no.
Pinto, no. Poppy.
Poppy, no.
Poppy, no. Poston.
Poston, aye.
Poston, aye. Pryor.
Pryor, no.
Pryor, no. Quam.
Quam, aye.
Quam, aye. Richardson.
Richardson, no.
Richardson, no. Robbins. Robbins, aye. Runbeck.
Runback, aye.
Runbeck, aye. Sandell.
Sandell, no.
Sandell, no. Sandsted.
Samstead, aye.
Sandsted, aye. Sauk. Sauk. Schumacher.
Schumacher, aye.
Schumacher, aye. Schultz. Schultz. Scott.
Aye.
Scott, aye. Stevenson.
Stevenson, no.
Stevenson, no. Sundin.
Sundin, aye.
Sundin, aye. Swazinski.
Swazinski, aye.
Swazinski, aye. Tabke.
Tabke, no.
Tabke, no. Tice. Tice, aye. Torkelson.
Torkelson, aye.
Torkelson, aye. Erdahl.
Erdahl, aye.
Erdahl, aye. Vang.
Vane, no.
Vang, no. Vogel.
Vogel, aye.
Vogel, aye. Wagenius.
Wagenius, no.
Wagenius, no. Wozlowick.
Oslowick, no.
Wozlowick, no. West.
West, aye.
West, aye. Winkler. Winkler, no. Walgamot.
Walgamot, no.
Walgamot, no. Zhongjae.
Zhongjae, no.
Zhongjae, no. Zhongti.
Zhang T, no.
Zhongti, no. Joachim.
Joachim, no.
Joachim, no. Speaker Hartman. Speaker Hartman, no. Acom.
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 Baker.
Baker, aye.
Baker, aye. Carlson, L.
Carlson, L, no.
Carlson, L. No. Eklund.
Eklund, yes.
Eklund, yes. Edelson.
Edelson, no.
Edelson, no. Gunther.
Gunther, yes.
Gunther, yes. Hamilton. Hamilton. Heinrich.
Heinrich, aye.
Heinrich, aye. Her.
Her, no.
Her, no. Johnson.
Johnson, aye.
Johnson, aye. Lehman. Lehman. McDonald. McDonald. Moran.
Moran, no.
Moran, no. Purcell. Purcell. Sauk. Sauk. Schultz. Schultz.
Read the names again?
Yeah. No, did you just finish?
I just finished. Yep.
Did you get Acom? Acom dropped off. Okay, Acom is back in the
Call
waiting
Acom.
room, and then Powers.
Acom.
Acom, no.
Acom, no. Halverson. Halverson.
Halverson, no.
Halverson, no. Yeah.
The clerk will close the roll. The motion did not prevail.
House concurrent resolution number 1 is being referred to the Committee on Rules and Legislative Administration.
It's my understanding that Representative Drazkowski and Representative Miller withdrew their motions.
Madam Speaker,
Representative New.
point of parliamentary inquiry. Can we get the result of that last vote, please?
It takes 90 votes to prevail. It was not close to 90. That they are working on an accurate count here. We're testing the new software and want to make sure we've got it right before we rely on it too much. The human beings and the machinery agree. There were 62 ayes and 63 nays, and the motion did not prevail.